Hi, I'm Ken Griffin, CEO of the Australian Primary Healthcare Nurses Association. And today we need to talk about something urgent. Australia's healthcare system. Australians need better healthcare and they need it now. And nurses are part of that solution. And at APNA, we've joined forces with the biggest nursing and midwifery organisations, 9 of them because we believe it's time to stop talking in circles and start delivering real results together. The 7 actions we're pushing will make an immediate difference. Less waiting, more care, better outcomes. And at the heart of it all, it has to be nurses. And let's be clear, other health professionals will always have an essential role and will always work with them. But we can't ignore the evidence that the largest workforce in Australia are nurses, and nurse-led care must be part of the solution for Australia's health system. Nurses should be prescribing medications. They should be leading more clinics, and they should be getting patients to specialists without unnecessary delays. Nurse-led care can reshape our healthcare system for everyone. Take rural and remote Australia. These areas are suffering some of the largest issues they have ever had as far as waiting times to see GPs, waiting times to see specialists, which often strengthen into months, and with regional hospital emergency departments overstretched and often closing. But in these same areas, nurses are there and they're ready to help and they're capable of helping. Nurse-led clinics can, and in some cases are, already bringing healthcare directly to the communities that are most in need. And that's why we're calling for funding to support more of this. More nurse-led clinics, especially in rural, remote and underserved communities. Because this will enable nurses to take leadership roles in delivering community-based primary healthcare, which is all about keeping people well and out of hospitals. And here's something our political leaders could change right now. Registered nurses and midwives should be able to directly refer patients to specialists. No more waiting unnecessarily. This is an action that will reduce waiting times, cut costs, and ensure patients receive the timely care that they need. We're calling for the immediate ability for nurse practitioners and endorsed midwives to refer directly to specialists, which will reduce the burden on GPs and give patients faster access to the care that they need. This is how we tackle long waiting lists and skyrocketing costs head on. We need more nurses and midwives in general practice, especially in rural and underserved areas. But any increase in funding, for example through the workforce incentive payment, should be tied to nurse and midwife-led clinical care so that more patients receive the personalised care that they need from the nurse using all of their skills to do it. And when it comes to diagnostic care, let's take more action. Our leaders need to enable qualified, registered nurses to order diagnostic tests like mammograms, x-rays and DEXA scans, and patients shouldn't have to wait to get a rebate for that. And midwives should also be able to directly order NIPT tests, pelvic ultrasounds, and other essential diagnostic tests and support women's health, which we know they can deliver so well. This is safe and effective reform that aligns with the bipartisan commitment from our political parties to women's health. It would also cut frustrating delays and costs for women and is within the scope of practice of our amazing nurses and midwives who are qualified to deliver so much more care than the system lets them right now. Our nurses, midwives and nurse practitioners are ready to lead and we need more of them. And that's why we're calling for increased training and job opportunities in critical areas, primary care, aged care and regional communities. If we want a healthcare system that delivers, we need to invest in the largest workforce that we have that already makes it happen, and we need to use them well. We can keep arguing over outdated models that don't work, or we can build a healthcare system that's ready for the future, and the future that Australians deserve. We choose action this election. We choose action as the largest workforce in Australia. Nurses are here to lead the way, and together with 9 peak nursing and midwifery organisations, we can make sure all Australians get the care they deserve, faster, better and more affordably.